Hi everyone, this is Dr. Ashpi Aluna Dogra bringing you greetings from Suhana Hospital, Mohali. आज हम बात करेंगे क्या होता है fertile period, कैसे कैलकुलेट करना है fertile period and why it is important to know your fertile period. So, we all know that लाखों करोड़ों लोग all over the world are trying to conceive. किसी के पीरियड्स इरेगुलर हैं, किसी को पीसीओडी है और किसी को हार्मोनल प्रॉब्लम है. तो फॉर ऑल ऑफ दीज पीपल इट इज वेरी इंपॉर्टेंट टू नो देयर फर्टाइल पीरियड एक्यूरेटली टू गेट प्रेग्नेंट. एट द सेम टाइम it is also important for patients or people not wanting pregnancy or wanting to avoid an unplanned pregnancy to know their fertile period. So what exactly is fertile period? Fertile period आपके menstrual cycle का वो particular days हैं when your chances of getting pregnant are maximum. हम सब जानते हैं कि एक menstrual cycle जो है 28 days का होता है, which can vary from 21 days to 35 days. Now, day 1 of the menses is the day of the onset of your periods. So your day of ovulation is 14 days prior to your expected date of next menses. For example, if your period duration is 28 days, then your day of ovulation is day 14. And if your period duration is 32 days, your day of ovulation is day 18. And if your period duration is 40 days, then your day of ovulation is 26. So what is exactly ovulation? Ovulation is the day when the mature egg leaves your ovary. Now, we all understand that life of an egg is roughly 2 days. And after an intercourse, the life of sperm is roughly around 5 days. So, your fertile period is 2 to 3 days prior to 2 to 3 days later after your day of ovulation. So, if your cycle duration is 28 days, your fertile days are between day 12 to day 16 of your cycle. And if your cycle duration is 32 days, then your fertile period is somewhere between day 16 to day 20 of your cycle. Same way, if your cycle duration is of 40 days, then your fertile days are roughly between day 24 to day 28 of your cycle. So ये तो बात हुई जिनके पीरियड रेगुलर हैं. सो रेगुलर पीरियड वालों को भी अगर किसी पर्टिकुलर साइकिल में कोई स्ट्रेस है या कोई एंजाइटी है, देयर इज अ पॉसिबिलिटी दैट देयर डे ऑफ ओव्यूलेशन कैन वेरी. अब बात करते हैं उन लोगों की जिनके पीरियड इरेगुलर हैं या जिनको हार्मोनल डिस्टर्बेंस है. वो कुछ ऐसे साइन या सिम्टम्स अगर अपनी बॉडी में ऑब्जर्व करें, दे कैन श्योरली एसर्टेन देयर डे ऑफ ओव्यूलेशन. सबसे पहले बात करते हैं बेसल बॉडी टेम्परेचर की. बेसल बॉडी टेम्परेचर वो टेम्परेचर है विच इज एग्जैक्टली द टेम्परेचर व्हेन यू वेक अप बिफोर लीविंग योर बेड, प्रोवाइडेड आपने कुछ खाया ना हो, कुछ पिया ना हो और ना ही किसी से बात करी हो. This basal body temperature, if observed on a daily basis, you will notice that it attains its peak to somewhere around 0.5 to 1 degree Celsius more than your temperature on the day of ovulation. This basal body temperature stays high and till you get your periods. So, आजकल तो मार्केट में बहुत सारे ऐसे थर्मामीटर्स अवेलेबल हैं with the help of which you can calculate your basal body temperature. Another method is your position of your cervix. Cervix यानी कि mouth of the uterus. So you know what? This cervix is slightly behind, firm and closed on your routine days. But on the day of ovulation, it becomes softer, it slightly opens up and becomes a little forward to receive the sperms during the intercourse. Another way to ascertain your day of ovulation is vaginal discharge. The vaginal discharge that comes from your cervix is usually scanty after the menses. But on the day of ovulation, it becomes watery, thin and copious, just like the consistency of egg white. So if you hold it between your fingers, you can stretch it somewhere up to 8 to 10 centimeters. So apart from all of this, there are lot other ways that women can assess her ovulation days. So apart from these methods, there are certain other signs that a woman may experience in herself to ascertain her day of ovulation. Like some women may experience a little heaviness or tenderness in their breast, while others experience a strong sense of smell during those days. There are many other females who have said that they feel a little swelling on their vulva or vagina during the days of ovulation, and there are some other women who may experience strong sexual drive during the days of ovulation. But the most important is Mittelschmerz. Mittelschmerz means mid-body pain. So certain women experience a little pain in their lower body on the days of ovulation. Some women experience a strong sense of smell on the days of ovulation, while others have a strong sexual drive on those days, while others even experience a little swelling on their vulva or vagina on the day of ovulation. इन सब चीज़ों के अलावा there are lots of modalities available like ovulation studies or follicular studies, which are ultrasounds which can help us ascertain your days of ovulation and also your fertile period. So, I would like to say it's very important that we are careful, we are watchful, and we have an insight into the various signs and symptoms that our body experience, which can surely help us ascertain our days of ovulation and hence the fertile period. In the end, I would like to say, pregnancy should be by choice and not by chance. So if you found this information useful, or if you have any other queries, please leave your questions in the comment section below, or you can visit us at Suhana Hospital, Mohali. Thank you so much.